Antibiotic resistance is now outpacing modern medicine, putting many lives at risk. A new report by the World Health Organization predicts a 70% increase in deaths as a result by the year 2050. How serious is this increase in antibiotic resistance?
What if I told you that one of the world's greatest medicine was discovered because someone forgot to clean a petri dish? In 1928, scientist Alexander Fleming noticed that a mole had accidentally contaminated his bacteria culture. The bacteria surrounding the mole had magically disappeared, and the mole later became the world's first antibiotic. The discovery of fungal antibiotics revolutionized modern medicine and continues to shape the pharmaceutical industry today. As antibiotic resistance becomes an increasing global challenge, scientists are once again turning to fungi in search of new solutions.
Recent studies have shown that fungi produce various secondary metabolites of antibacterial, antiviral, antifungal, and anti-cancer properties. These discoveries are particularly important because the increasing prevalence of antibiotic-resistant bacteria has created an urgent need for new antimicrobial agents. Through fungal genomics and molecular studies, scientists can now identify genes involved in the production of these valuable compounds, allowing the discovery of potential future antibiotics. However, one major challenge in healthcare today is the antibiotic resistance, where bacteria become resistant to existing antibiotics. As a result, researchers now investigating fungal metabolites as potential sources of the new antimicrobial drugs.
The pharmaceutical industry represents one of the most significant applications of fungi. One important example is penicillin, produced by the fungus Penicillium chrysogenum. Another example is cephalosporin, produced by Acromonium chrysogenum. The industrial production of antibiotics involves a several scientific process. Firstly, high-yield fungal strains are selected and maintained under dry condition. And secondly, the fungi are cultivated in the large fermentation tank called a bioreactor, which contain a nutrient such as a carbon and the nitrogen sources. During fermentation, environmental factors including the temperature, pH, oxygen supply, and the agitation are carefully controlled to maximize antibiotic production. The antibiotic compound produced by the fungi are then extracted, purified, and tested for the quality and formulated into the pharmaceutical product.
Technological advancements have significantly enhanced the application of fungi in pharmaceutical industries. Genome sequencing enables scientists to identify genes responsible for antibiotic biosynthesis. Automated bioreactors equipped with sensors continuously monitor temperature, oxygen concentration, pH, and nutrients level during fermentation. In addition, bioinformatics and artificial intelligence are increasingly used to analyze fungal genomes and predict potential drug-producing compounds. These technologies improve productivity, reduce production costs, accelerate drug discovery, and increase the overall efficiency of pharmaceutical manufacturing.
At the beginning of this project, our group viewed fungi mainly as microorganisms associated with decomposition and food spoilage. Even so, through our independent research, we discovered their important role in pharmaceutical production. Studying antibiotic production allows us to connect concepts learned in mycology, such as fungal metabolism and fermentation, with real industrial application. This experience changed our perspective on fungi and helped us appreciate their contribution to medicine, biotechnology, and human health.
From a microscopic fungus to a medicine that saved millions of lives, the journey of antibiotics shows the extraordinary potential of fungi. As research and technology continue to advance, fungi remain one of the most valuable resources in modern healthcare.